It's me, Vad B. I'm back. I just had my 3-month follow-up with breast clinic. So post double mastectomy and straight to implant reconstruction. I got to go to the new surgical center. So it used to be a private hospital. So it's so nice and they renovated it. My appointment was at 8:30. I got to see the doctor at about 8:50. So it wasn't too long of a wait. She was very young and I get the feeling she didn't quite know what she was doing. So she said to me, okay, we'll have to do a mammogram and ultrasound in a year. And I said, well, because of had a mastectomy, I was under the impression I didn't have to do a mammogram, just an ultrasound. And she's like, no, you still have to. And I was like, okay. But then she went out to check and she's like, I've just spoken to a different surgeon. They said that you didn't have to do it. And I was like, yeah, I said that. She did a physical exam, but I'm not sure. I feel like it was such a nothing appointment, like such a waste of time. She said that they'll schedule a 12-month follow-up with breast clinic again, so same thing. I don't know. I have my plastics 3-month follow-up in 2 days as well, so hopefully that's not a waste of time. I think it's going to be with the surgeon who did my surgery, so that's good.
2 days later.
Hey, it's me. So I just had my 4-month follow-up with the plastics team after my double mastectomy and straight to implant reconstruction. So I was supposed to be seeing the plastic surgeon who did my implant reconstruction, but she's away. So I saw this other guy that I haven't met before, but he was nice. He had a look and he said that everything's looking really good. He said the scars are healing up really nicely. And he said that they'll drop more in the first year and look more normal or more natural. And I said, I don't care if they don't look natural. I just want them to look nice. And he said they look amazing. And I've been trying to fade the scars, so I've been massaging them with bio oil. And he said it doesn't really matter now because they look really good. And in about 5 years, all scars are going to look the same. But apparently, there's marginal improvement with scar tape. He said he doesn't think the plastics team needs to see me anymore and that from now on just monitor them, and it's not if I have a problem but when. So the most likely things to happen will be capsular contracture, where there's like a scar kind of pocket in there around the implant, and that can harden and then like compress and then move the implant, or if there's a rupture, and that can usually happen after some like low level trauma like a small car crash. And usually when implants rupture, the type of implant now, it will not like leak everywhere, but it will just kind of like come out of the implant a little bit. But with that scar pocket, it should stay in. And some people can have the implants in forever and they're fine, or earlier on there'll be a problem. And I said, can I prophylactically change them in 10 years to prevent that from happening? And he said, well, not in the public system. It won't be paid for unless there's a problem. But if I wanted to do that, it would cost like $15,000 because I'd have to go privately because the implants and the surgery wouldn't be covered. So I guess I'll wait and see, and hopefully nothing bad happens. Yeah, he said they look really good. So it was a really quick appointment. I got there at about 9:45 and my appointment was at 10. And then I was out by 10:15, didn't have to do any follow-ups. So yeah, that's where we're at. And there was like a little kind of lump along one of the scar lines, and he said that's probably an internal suture or like the edge of the implant. So it's nothing to worry about. I went, wow, stay tuned.